Hi everyone, my name is Yusuf. I am from Leeds. I'm reporting for Room Now at this year's EULA 2022 conference at Copenhagen, Denmark. Today I am delighted to be joined by Dr. Lucy Carter, also from Leeds. So Lucy today presented her abstract OP 0246 to 6, for which she won the prestigious Best Abstract Award in Basic Science at this year's conference. Hi, Lucy.
Hi.
Would you like to just describe some the background of your student studies?
Yeah, of course. Thank you. So the premise of our work was to study the transition between ANA positivity to a classifiable autoimmune connective tissue disease such as lupus. We consider the ANA positivity to be an at-risk state for diseases such as lupus, but it's only a small proportion of people who are ANA positive who ultimately display disease. So we wanted to understand some more of those mechanisms.
Great. And can you please describe a little bit of your methods and also summarize your main findings?
Of course. So for this study, we recruited individuals who were referred to rheumatology services with ANA positivity and some low-grade symptomatology that was of concern to their primary care physician, but not meeting any classification or diagnostic criteria for SLE. They provided us blood samples from which we isolated PBMCs at their baseline visit and performed bulk RNA sequencing on those samples. Now, those patients were followed up for 12 months, and their progression or non-progression to lupus was defined at 12 months and adjudicated. So we were able to compare the transcriptional signatures in progressors and non-progressors to look for trends which were related to their disease state. I used a WGCNA analysis on the RNA sequencing data, and that has revealed to me three key modules which were related to progression from ANA positivity to lupus, one of which was predictive of progression and two of which was actually protective for progression.
So I think it's really interesting because you're using a novel technique and also you found not just predictive but also some modules actually protective. So I think this is really important to carry forward. So just the last bit is what would be the clinical implication and what's your future plan?
Thank you. So the implications is really trying to understand the pathogenesis of this very early stage of evolving connective tissue diseases with the hope that we can have interceptive therapies that can prevent fulminant disease developing. That's the global ambition. But in the short term, we've got gene targets from these modules, which are targets for validation studies in the first instance.
Fantastic. So I hope all goes well. Thank you for your attention. And if you would like to have more contents, follow us on Twitter, YouTube, and also the website. Okay. Bye bye.